Good afternoon, everyone. This is Andy Reese, Director of Department on Disability Services. Um, I will start by reviewing our data for the since last week. Uh, Shared the wrong screen, so I'm starting over again. Sorry. There we go. So at this time, to date, we have had 376 people test positive. You may notice there's an addition there in December because there was someone who was just reported. So, as we get some of these reports, we would then add to that number to make sure that we're accurate going forward. If someone's being real on top of it and adds up each month, you'll notice that there are two more reports in there than we have people, because as I've said before, to date, we have had two people who have both tested positive and had COVID two times, not just tested positive. Both of them had it in April. One of them contracted it again in December and the other one in January. And interestingly, sort of. I mean, one of them, when they had it the first time, was asymptomatic and became hospitalized the second time. The other one had it with more serious symptoms the first time and is asymptomatic the second time. But to date in January, we have had 33 people test positive for COVID. So total by placement type, in host home, there have been 6 people. Intermediate care facility, 111. Mental health facility, there's been 1. In a natural home, 43. Nursing home, 2. And out-of-state placements, 4. Residential habilitation, 34. And in supported living, 175. And so, in terms of sort of the larger placement types for people in intermediate care facilities, 37% have tested positive. Of those 30, of that total, 111 people who have contracted COVID, 20 have died. However, just 12 of those have been confirmed as actual COVID deaths, resulting in a 10.8% death rate from COVID for people in ICFs. For people in natural homes, 43 have contracted COVID. There have been 5 deaths among those 43, and all 5 were confirmed as COVID, which would be 11.62%. In residential habilitation, there have been 34 people who have tested positive. Of those people, 3 have died and 2 were confirmed as COVID deaths so far, and that results in a overall death rate of 5.88%. In supported living, there have been 175 people, which is 18.7% of the total. There have been 15 people who had COVID who were in supported living who have died, but only 12 of those have been confirmed as COVID deaths, resulting in a rate of 6.86%. And overall, as I said, there have been 376 people, which is 15.65% of the total number supported by DDA. Of those, 45 have subsequently died, with 33 who have been confirmed as COVID deaths, which is an overall percentage of 8.77%. So by placement type, by month, what you can see is that in January, we've had 9 people in ICFs who have contracted COVID, 17 in supported living, 1 in residential habilitation, and 6 who were in their natural homes. Of the people who have contracted COVID, those who've required inpatient treatment, there were 7 in January, and there are currently 7 people hospitalized. And as I had indicated earlier, of the people who have contracted COVID who have died, there have been 45. To date, 7 of those have been confirmed as not COVID related, and we are still awaiting confirmation from the Office of the Chief Medical Examiner regarding the cause of death for 5, including 1 person who did die in January. That person had COVID in August and had recovered. And so of the 33 who are confirmed to have died from COVID, as you can see, there were 4 deaths in December from COVID, and to date, no confirmed COVID deaths in January. Just a bit of an update. I believe I had misspoken previously. I had talked about the coordination we are doing with DC Health regarding vaccination for people who are in intermediate care facilities and residential habilitation. We have coordinated with them, and about 80% of the people are wanting to be vaccinated, and those are actually scheduled for next week. I think I had originally thought we provided them with all the names last week. I thought those would be occurring this week, but they're actually occurring next week. As people may be aware, this week was not much of a week. It was a short week for most of us, but and a difficult week to be traveling around the district with people. So at any rate, we do have 80% of the people who are scheduled for next week on 2 days next week, and we will be following up to confirm that those folks actually did get vaccinated, and then also following up with the other folks who chose not to at this time, just so that we can understand is there some barrier to them getting the vaccine? Is there some more education they may need, more information they want? Are they just waiting? Keeping in mind, there are some people who may have had COVID in the most recent 90 days who may be waiting. And so we'll be following up on all of that in the coming weeks. That's the problem. I couldn't see the presentation. Apparently, I was still sharing my blank screen. So I think that's all the information I have. The charts are not available on our website. I guess we could talk about making them available, and I'll update you next week on whether that might be possible. But yeah, at this time, they're just available here. But we could see if that might be something that could be done. Oh, and I'm sorry, the charts reference, and I don't want to lose sight of this, the charts reference the people supported by DDA, and but we do regularly continue consistently to track the provider staff, and to work with DC Health on contact tracing for provider staff, 25 of whom tested positive in the past week, for a total to date of 575 staff, 45 of whom work at more than one agency. And sadly, there have been 10 deaths among provider staff. I know Friday seemed to come quickly this week, although in some respects the week felt very long. But I know yesterday evening I thought, oh, wow, tomorrow's already Friday. So it looks like maybe people haven't formulated any new questions for us, which is also always fine. Oh, absolutely. Yes. The 80%. So the 80% is only people in ICF and ResHab. The total population there was, I had all those numbers written down in front of me, and I wasn't working here. So out of about 350, give or take, I think it's like 365. And so it's 80% of them. In addition to those people, there are about 200 people who are 65 and older who are also eligible to get the vaccine. And so we sent something out to all the providers on the Monday that it first became available to people 65 and older so that they could help people with registering. And we'll be following up to monitor sort of, who has registered to get that vaccine. Do they need any help getting that done? Following up with people who may need additional assistance. I'm sure anyone who's reading the newspaper is aware that registering for the vaccine in that circumstance is challenging, because of just the availability in terms of the numbers. Once they make them available, people log on and they sign up for them. When you log on, there is a telephone number. At the Project Action meeting, I guess it was just a week ago, we provided all of those folks with the phone number. Those meetings, which are really well attended now, I think there were about 90 people at that meeting, which was far more than they used to have. I'm really impressed with some of the advances we're seeing with people's capacity to engage in virtual meetings with folks. So I see there's a DC Health Director Nesbitt announced yesterday a very broad set of people are going to become eligible for the vaccine soon. Will other non-ICF, non-ResHab below 65 be eligible soon? So I think I walked through before the rollout schedule is on the coronavirus.dc.gov website. And I'm just going to pull that up. And given, so to date, the people who are not 65 and older, who are not living in an ICF or a ResHab, potentially would qualify as people with an underlying medical condition, and I want to make sure that I'm using the exact language from DC Health. And those people, if I'm not mistaken, and we do have Karen Stringfield with us today. Um, so, feel free, Karen, at any time to jump in. Those people are able to register for the vaccine in group, I believe it is 1C, but I'm gonna, as soon as I can find the document from the website, I'll pull it up and we can walk through it. But there hasn't been, I mean, there hasn't been that I've heard, and perhaps Karen, you could share if you've heard any sort of the rollout is what the document that's been provided to us. I haven't heard that rollout is changing. It may be that there's the expectation that people with underlying health conditions should be coming up soon. But
Yeah, I think Director Reese. Hi, it's Karen Stringfield. I think the last Friday conference call, Winslow shared the link that basically gave the updated kind of outline to that. It is on coronavirus.dc.gov/vaccine. If you can pull it up, Director Reese, and share it, that will probably be the best thing, just because it does kind of go through all that. What I do want to just kind of reiterate is making sure that people understand that 65 and older can register to get the vaccine. And there also is a sign up where you can basically be informed of when your group is going to be eligible. So if you go onto the website and you put in all your information, you can be sent an email to let you know when your time is there.
So can I ask you a question about that? Karen, is when you go on the website, I know there's a place where you go on, it says sign up for alerts for future announcements. But there's also the place where you can, down at the bottom at that same place, where you can go into the portal and, I guess it's only when appointments are available that the portal's available. If you went into the portal before it was your turn, what would happen?
Usually it would kick you out, or it asks you basic screening questions. So,
Right.
and if you do not qualify for that, it will basically tell you that you're not available. And then if you do try to still make that appointment and you somehow deceive our our screening, then the pharmacy where you have registered for the vaccine, it is then their due diligence to verify that information through whatever their processes are. So
Okay.
that's pretty much our safeguard.
Thank you. I was just curious because before I went to Project Action, I wanted to talk to them about how you register online. So I walked through the whole process without going to the end and hitting yes, schedule an appointment. And I was curious at what point it would say to me, you're not 65, you can't do this. So apparently it waits till it's asked all the questions and then says, you can come back later, I assume. So I will share again. So as people, so I, in phase 1A, long-term care residents, as well as frontline public health workers, fire and emergency, and healthcare personnel. And as people recall, healthcare personnel included all of our DSPs, all of our staff who have any direct or indirect contact with the people we support. So it goes beyond DSPs. And I saw a question about that, and I'll get to the answer about that after I finish going through this. 1B is continuing with long-term care residents. And so essentially, while people that live in intermediate care facilities and residential habilitation were considered 1A, they were the part of 1A that was in continuing in 1B Tier 1. And so that's why at this time, so the same week that the portal was open for people 65 and older, it was also, we also gathered all the names and coordinated with DC Health, as I said, to schedule vaccinations for next week for all of those people who were interested. In addition, in terms of employment settings, non-healthcare staff that work at vaccination clinics, other staff working in congregate settings, which all of our staff have already had access to the vaccine, and correctional officers. Continuing in phase 1B, tier 2 is continuing residents 65 and older, continuing to get to long-term care residents. We'll continue with the folks, as I said, we'll get to 80% next week. We'll have an understanding of the issues causing the other 20% not to be interested in this time, and they could be eligible at any point then going forward to get the vaccine. They'll be doing the vaccination at correctional facilities, detention centers in phase 1B, tier 2. They'll also be doing all staff who work in K-12 educational placements, all staff working in childcare, and staff who work at grocery stores. Phase 1B, tier 3, continuing with all the people from the earlier tiers and adding to that a variety of different staff who work in courts or provide legal services, people who work in health, human services, or social services outreach programs, employees of public mass transit, people employed in manufacturing. I don't know who that would be in DC, or food packaging and distribution, and postal employees. And then we get to phase 1C, which is people who are under 16 years old to 64 years old with a chronic medical condition with increased risk of complications for COVID, or a chronic medical condition as defined by the healthcare provider. And as I've said before, the documentation that may be required for that, we have not heard yet. And as we get closer to that time, then we'll be able to share that information. At that same time, essential employees in local government, and essential means people who are unable to continue doing their work via telework and are required to work in person during the public health emergency. So in our agency and other district agencies, for example, people are identified as essential, but for this public health emergency, we identified staff who were essential to continue to work in the office, and those are the people that are included here. And then also, staff who work in food service, essential employees in non-governmental health, human service, and social service agencies, and people working in commercial and residential property maintenance. And then tier 2 of phase 1C would include all the same people from the earlier phases and tiers, as well as people who work for delivery or courier services, people in non-public transportation services, for hire vehicles, rideshare, Uber, etc. and essential employees who work in media and mass communication. And then phase 1C, tier 3, people who work in construction, essential employees working in IT, essential employees in the federal government agencies, and people working in commercial and residential property management. And once again, just the reminder that essential is not the sort of traditional sense of essential, but essential means that people who are unable to execute their job functions via telework. And then we move to phase 2, which is essentially everybody else, all district residents 16 and older who have not been included in the previous phases. As Karen said, and as Winslow had said before, this document is available on the coronavirus.dc.gov website. And so you can go on there and see it. So do we know the percentage of provider staff that have received the vaccine? Not at this time. We are following up with providers so that we can monitor the number and percent of provider staff who are vaccinated. I see a comment here. I don't know exactly what it's about, but I can guess. Very challenging is all it says. Was on Monday and today on time, but no available appointments. And it is true. Now, keep in mind, as Karen said, you can, as soon as you go into the website, there's a place where you can ask to get to receive a text when there's any update about the vaccine, so that when it is available, they will send something out. And you can check back there. There is also a phone number that people can call. And I can, so my question is whether IDD waiver recipients will be included in the group just announced by Nesbitt. So, well, that's interesting. Oh. There are so many ads on this thing that it's pretty impossible to be able to read through the ads to see we have not gotten any update other than the update that I just shared. So, from what I know, nothing has changed. It looks to me like this is just announcing. I mean, I don't know if they're suggesting that some people at higher risk are being moved into the 65 and older group, or are they just announcing that the high risk group is coming soon? And if you've read this and can share that so that I don't take up our time trying to read an article, especially having to dig through the ads on the article to be able to read it. I do see a lot of comments here about the challenge. It says the link shared by Winslow says not found.
I shared an updated link, Director Reese, and it's working. So
thank you.
What happened is I did a bad copy and paste this week, but I didn't share the link from last week. I tried to grab it, didn't get all the letters in. So
Nelson has reshared it. Thank you, Nelson. And people can see the link there. So it says if you are able to register, you can only register if you live in certain zip codes. Most of our staff are not in those zip codes, so they cannot register. So I think I need clarification from Karen for this one. I don't know if the website, so for staff, that zip code thing shouldn't apply.
It shouldn't apply. What the aim was is to make it a more equitable system. What we noticed is that in the rollout of the 65 and older was is that there were people in certain zip codes that were pretty much dominating the appointments, and which made it harder for those in other zip codes, mainly, I think it was 4, 5, 7, and 8, to get vaccinated. So, in an effort to just make it a more equitable system and to make sure that we are covering those who are most at risk, the zip codes were turned off for the 65 and older group. Staff should still be able to get appointments if there are appointments that are available. So it may be user error. I don't want to just assume that it is, but it may be some user error. Just have them to go back and try to do that again. And I think that it only lasts for a temporary time. So just wanted to make sure that people keep trying to log on and utilize that text function as well to see when appointments are available.
So there is also, and I don't see it here right now, and I'm wondering if that's because the portal's not open. There's a phone number that people can call. Do you have that phone number, Karen? Because I'm looking at the website and don't see the phone number I had shared from the website before.
I do have it. Give me just 1 second to pull it up and then I'll share it in the chat.
That'll be great. So I'm concerned that providers registered for the vaccines next week are not permitted to use a provider consent form. We just today received the consent form from Giant and wants us to have the decision maker fill it out and bring it to the appointment times. Many families do not use technology and take their time in responding to urgent matters. I'm concerned that people that have already have consents in place will not want to take the time to consent again and send it back timely, leaving people with no vaccine. Giant has their consent, so we can't speak to what Giant's going to require. I would just say, as soon as we received the consents from DC Health, from Giant, we forwarded them to everyone, and you should do your best to get those consent forms completed. If you had a consent form that was already signed and you attach it to the Giant form, I don't know if that's acceptable to Giant. But like I say, Giant has their consent form, and so they may have specific language that they want to ensure is there, because those consent forms protect whoever it is that's having you sign the consent form. And Nelson is saying that using the portal is the best way, not to use the hotline. So the hotline is available for people who either don't have access to or are not comfortable using the computer to walk through everything. There's a statement here, DC Health needs to figure out a way for the system to allow people who are DC residents but live in Maryland because DC housing costs are too high. I don't want to presume for people who live in Maryland that that's the only reason they've chosen to live in Maryland to sign up for the vaccine. Same for people who work in DC as frontline workers but live in Maryland. What is DC Health doing to take this into consideration? DC Health has allowed all of our staff who work supporting people who are district residents to register for and get the vaccine. So I know that for people 65 and older, there was this. I understand that for people 65 and older, there was a limitation on the addresses that people lived in. All of our provider staff were in Group 1A, and unfortunately, not all of them registered before we got to Group 1B, and so the availability is more limited. So people have to keep trying to register. My understanding is that based on how you respond to the questions, that's what will happen with the registration. And correct me if I'm wrong, Karen. I mean, I don't think that if someone doesn't live in those zip codes, but they answered the question that they are a healthcare provider, which is one of the questions, then they should be good. If they're not, I expect that that what might be easier in those cases, even though it is much more efficient to go through the website, then in those cases they might want to call the 855 number. But Karen, you could.
Yeah, I agree with you, Director Reese. And I think there was a statement that was above that asked about if the worker should put in their work address or their home address, unless otherwise requested. I think that the home address would be the best, but then, and I apologize because I'm not extremely familiar with how the website is set up as far as the questions that it asks, but making sure that you do identify yourself as a healthcare worker, because even though your staff may not be licensed or certified, they are still working in a healthcare capacity with your resident population.
And the website seems to be, as I said, I walked all the way through to the end, but didn't ask for the appointment. The website seems to be specifically asking for your address. And I assume for data purposes, they want to know who's getting this, and including likely the number of vaccines that have been provided to healthcare providers that care for people in the district who don't live in the district. Because as people may be aware, Maryland and Virginia both did, I've heard different reports of this, give or lend DC a number of vaccines because of the number of their residents who come into DC as healthcare workers. So it is helpful, I expect, where it asks for your home address to list your home address. So someone is saying that the staff put in the work address with the zip codes that were allowed as the only way they could register. So Karen, if you could just take that back to DC Health and let them know that the apparent limitation on one group is being imposed as a limitation on all.
Will do. Let me just also say that the address is not necessarily only for just to register, but also if, God forbid, if there was some reason that staff needed to be contacted because of whatever reason, we want to make sure that we have accurate address and phone number. And even though addresses do change, sometimes work locations change as well. So we just want accurate information. So that's why I'm saying that the home address is probably the best one to put in. I understand that people are kind of scrambling to just get an appointment, but I just wanted to put that out there that we do want to make sure that they're putting in their home addresses and either their cell phone or their home phone, whichever is best to contact.
So someone has commented that the process for registering folks from ICFs and res tabs for getting the vaccine was very seamless. Thank you to DC Health and Kirk, who worked together, and to our providers who responded very quickly, for 350 people. Supported living is 900 and some people. So we will take back the suggestion and the hope that is stated here that there could be some kind of sort of, in the same way, a set aside of identifying some times and locations when those people could be vaccinated, when we get to that group. And we can talk further with DC Health about that possibility to see if that is possible. And I know for a number of reasons, in terms of tracking, for us, it would be easier as well, albeit a bit heavier lift than what was done in the last couple of weeks regarding people in ICFs and ResHabs. But we will see how possible that is. Right. Prior to the question for the zip code, I thought it asked about your ward. That was what I remembered, but maybe it said zip code too. I just remember there was a limitation on like wards. Was it 1, 2, 3, and 6? Prior to the question for zip code, the first question was, do you work for a healthcare setting in DC? Which was very easy. And just to clarify for people, we're interpreting that to mean, do you work for a healthcare setting supporting DC residents? Because I recognize some of our folks are actually working in Maryland, but we are counting everyone as working to support DC residents.
Director Reese, if I can interject for a second, there was a text message that came in last week that was overlooked, so I'm just going to ask the question now. Somebody wanted to know, will there be provisions for people with disabilities who don't wear masks or are not able to leave their home to get the vaccine?
So not able to leave their home is easy, yes. We will be working that out. And people who don't wear masks, the only challenge there is where it's being administered. So for example, with people from intermediate care facilities and residential habilitation, there may be folks who are not, if you're not able to independently remove a mask, you should not have a mask on. And so for those, and there may be some of those folks next week, and I'm pretty certain we've already clarified this with DC Health, because the giant consent has information in there about if you're unable to wear a mask, talk to us later. But those are written from our perspective for people getting the vaccine at Giant as opposed to at this location next week. I'm pretty certain we worked this out. So someone could correct me if I'm wrong there, because we do have a number of people who, for a variety of reasons, would not be able to independently remove a mask. And that is a consideration people are going to have to take into account when scheduling for a vaccine. And in those cases, they may want to coordinate, and we should talk further about this, about coordinating in those cases, whether the person goes out or has the vaccine brought to them. Okay, so what I'm seeing since I don't see questions, I'm starting to read the article. And what it appears to me is what I had said before, which is that the DC definition of an underlying health condition is going to be broad. It is not that anyone with, and I've only read the first page, it is not that anyone with any of the variety of underlying health conditions are being moved into an earlier category, just that once we get to that category, that group of people will be broad. So it does say here the original goal, which I had heard before, for people in 1C was to begin vaccinations as soon as February 1. But given the high demand from people in 1B, particularly since they've opened it up for seniors and the high demand for seniors in the district, and the limited supply of vaccine that's been coming in to date from the federal government, they don't expect that they will make it in by February 1 for Group 1C. So it appears from this that there will be no documentation required. Once we get to 1C, there will be a question about whether you have one of the underlying health conditions. Or an underlying, right. And so there is a white paper that I could share with people if they're interested. There is a white paper that has suggested that people with intellectual and developmental disabilities are at higher risk. When you get into the data that's in the paper itself, I think a more complete and accurate picture of it would be that people with intellectual and developmental disabilities are more likely to have these underlying conditions, which then places them at higher risk. But as I said, each person will have to answer that question on their own. And we'll continue to follow up with DC Health regarding availability of vaccine and how we coordinate the administration of it. Because at this point, we've only gotten to a point where we've got a little more than a quarter of the people supported by DDA who've been eligible to register to get the vaccine. And we would all like to see everyone get vaccinated as soon as possible. including the people I talk with at DC Health. But as I said before, you know, the limited supply that comes to the city regularly from the federal government does have an impact on how they can open it up to the various different groups. And my understanding is that age seems to be the one of the factors most highly correlated with outcome. I would say a majority of the people supported in an ICF are unable to wear a mask. Why would the administration be set up in a public setting? When will we know about in-home delivery? I would assume that most people who have appointments next week were folks who cannot wear a mask, and based on this conversation, likely will need to cancel their appointment. That is not what I said at all. What I said was, if you read the information from Giant, it is it is attached to an email that says you will notice that the information in Giant's consent says if you're not able to wear a mask, you should defer coming to us, that is not applicable for the appointments we have scheduled next week. And I believe, and Karen and Kirk, you could confirm that that's accurate, but no, that is not true, because it is accurate that most of the people, or many people, I expect probably it may be most in terms of, you know, the ability to independently remove a mask, will be going without a mask. And so, you know, working out the logistics of providing vaccination to people in 61 ICF settings, and I think it was like 30 some residential habilitation settings, to go to each of those, as opposed to identifying a location where everyone could come to that location, seemed to be the most efficient way to make sure that we could get vaccination for the most number of people in the shortest period of time. I just wanted to caution people, which is what was stated in the email that went out to everyone. Don't get alarmed when you read the notice about the mask, because we recognize that many of the people that you will be taking there are not able to wear a mask. And please do not put a mask on someone's face if that person is not able to remove the mask. And if there's anyone from DC Health that would question that, please feel free to. But I think pretty clearly a person shouldn't have a mask on if they can't take the mask off. So it is now 1 o'clock. I'm very hopeful that I will have a good report to give everyone about how well it has gone on our 2 appointment days next week. I hope everyone has a nice, quiet weekend, stays healthy, stay safe, and I will talk with all of you next week. Thank you.